everyone. Thank you so much for joining me here on Clarke's Closer Look. For those of you who do not know me, my name is Clarke, and I'm an independent journalist here in El Paso, Texas. I really wanted to use this channel as a safe space to talk about those conversations we're seeing online or in our news channels, but also have those experts weigh in to really help us decipher the right information from the wrong and continue those conversations that we may be having with our loved ones. For this segment, I wanted to focus on ovarian cancer screening. I recently found out that there still is no universal way for screening for ovarian cancer. Typically, you have your mammograms when it comes for breast cancer or pap test when it comes for cervical, but that isn't the case for ovarian, and those results aren't as effective for our doctors to really decipher what to do and move forward. So much information to unpack, and we need our expert here to help us out. We have a special guest, Sarah DeFeo. She's the Chief Program Officer for the Ovarian Cancer Research Alliance. Guys, they're doing such wonderful work, providing so many resources to families in need battling ovarian cancer. I can't wait for you to check out my conversation with her, and hopefully you find it as useful as I did. All right. Well, Sarah, I wanted to thank you for getting the time to talk to us today. For our viewers, just a better understanding of who you are and kind of what motivated you to spread more awareness on ovarian cancer.
I am the Chief Program Officer at Ovarian Cancer Research Alliance. I've been with the organization for, I don't know, 15, 16 years, long time now. And it's been great. This is it's a great organization, great group of people, and an amazing community that we get to work with and support every day. OCRA is the largest ovarian and really gynecologic cancer charity in the world. We think the world. We know we're the largest in the US. We think we're the largest in the world. There are different ways to measure that, but we're not aware of a larger charity that focuses on ovarian and other GYN cancers. And we do lots of things. We fund research. That's how we spend most of our money, funding research all over the world. And we also focus on policy work and advocacy work. We have an office in Washington, D.C. that focuses on that, and staff people there. And then we do a lot of education as well, public awareness, and educating folks who are impacted by the disease directly, and support as well. So we have a very robust set of support programs that we offer as well. So we do lots of different things, all with the goal of supporting the ovarian and gynecologic cancer community, and advancing the interests of folks and families who are impacted by the disease. And it's been a great journey for me personally. When I started with the organization years ago, we were a much smaller outfit, probably about half the number of people that we have now. And over the years, we've just grown, and we've really been able to expand the impact of our work, which is wonderful.
Let's focus more on that impact, because I do feel that, we were focusing a lot on that detection when it comes to ovarian cancer. Many doctors sometimes resort to that symptom detection, but for most of our viewers who don't know, it's just kind of seeing the symptoms, going to go get that checkup with your doctors. But those symptoms include bloating, fatigue, change in bowel movement, and they're almost identical to a woman's menstrual cycle. So a lot of these symptoms go
not unusual stuff.
Yeah, it's a normal month for most women. Sarah,
exactly.
What do you want women watching this to be aware when it comes to advocating for their health? Because sometimes they go to their doctors, ask for this help, and they turn back around because their doctors don't really take those symptoms seriously.
Seriously. Yeah, you're absolutely right that the symptoms, we think it's important to know the symptoms of ovarian cancer as you've articulated them. Those are the sort of defined, accepted symptoms of ovarian cancer. But as you pointed out, those are very common symptoms that any person could experience at any time for any reason that most likely has nothing to do with cancer. So while we think it's important that women are aware that ovarian cancer exists and that these are the symptoms of ovarian cancer, because they can help, drive a woman to her doctor, they're because they're so common, it's not the most useful thing, right?
Yeah.
What we think people should focus on is if those symptoms are really new and unusual
Okay.
and persist. So we're not talking about your run of the mill coming and going. Everybody has experiences these things from time to time. In terms of symptoms, they really need to be very unusual and be more extreme and persist over time. And then if that's the case, you should go to your doctor and talk to them about ovarian cancer. But what we think is really important for people to understand is risk. So it's important to understand ovarian cancer is considered relatively rare. I mean, it's not super rare. Once you become aware of it, you start talking about it, you realize that yeah, you know someone who knows someone, or there's someone in your family who's been impacted,
Yeah.
but it's not as common as say breast cancer, right? Um, but we think so it's not necessarily so while something everybody needs to be aware of, it's not as prevalent as say breast cancer, right? Or prostate cancer for men. So we think it's really important that people be aware of their risk profile because for some women, their chance of getting ovarian cancer is much higher than others. And so that's something we talk a lot about as an organization is being aware of your family history and knowing your risk.
Mhm.
So things that can raise a woman's risk of ovarian cancer, the most sort of thing that can impact your risk the most is if you carry a genetic mutation. Many people have heard about BRCA1, BRCA2 mutations. Angelina Jolie talked very publicly about her experience, realizing that she had a genetic mutation. Um, that seriously raises your risk of developing ovarian cancer, breast cancer, and other cancers as well. So if you have a strong family history of cancer, especially breast or ovarian cancer, but really of any cancer in your family, you should seriously think about talking to a genetic counselor and potentially getting genetic testing.
Mhm.
Um, we believe that approximately 20 to 25% of all ovarian cancers are driven by a hereditary mutation. So that's quite a bit.
Yeah.
Um, so in terms of the possibility of reducing the number of women who end up getting ovarian cancer, if we were just better at finding those women who are carrying a high risk mutation, um, it, before they ever develop ovarian cancer, we could prevent a lot of women from ever getting the disease, from ever dying the disease in the first place by taking preventative action.
Mhm.
So, genetic mutation is sort of the biggest thing that can increase your risk. There are other things as well. Not having children, for example, but those are things that are, you know, just
Yeah.
sort of not as impactful in terms of risk profile. And there are things that reduce your risk, having children, breastfeeding, taking oral contraceptives. These are all things that reduce your risk.
Mhm.
Um, but it's really when we talk about messages for the general public, what we want to talk about the most is understanding your family history so that if you might carry a genetic mutation that raises your risk, you can become aware of it and potentially do something to protect your health.
Yeah. So let's say you do have those genetics within your family. How soon should one be tested for ovarian cancer?
Great question. If you find out that you have a genetic mutation, you would work very closely with your doctor to determine the best course of action. And what a person might choose to do would depend on a lot of different factors. There's no sort of um, one best thing to do. You know, if you're 30 years old, what you might do is different than if you're 40 years old versus 50 years old. Where are you in terms of your childbearing? Do you want to have kids? Are you, you
Mhm.
know, is that something you want to do? Are you done having children? Um, because options like surgical options, removing your fallopian tubes or removing your ovaries, um, is very protective and is something that is recommended. But of course, you know, that has a big impact on your life and on your
Mhm.
health. And so, a younger woman might not be ready to do that. Makes sense.
Right.
But it's something that you can talk to your doctor about. And your doctor will follow you closely and just ensure that when you're ready, you're taking the preventative steps, that you can.
And it's always very tough to process all this information very early on, but it's just a preventative
100%.
measure from the extreme situation that we could be facing. You
Yeah,
mentioned something there with fallopian tubes, and I feel like that's an information that's not really out there as much. I read that 70% of the most common and deadly ovarian cancer starts in
correct.
the fallopian tube. So
Mhm.
is that a new kind of a new aha moment that doctors have that that could be part of the solution with removing that if someone does have an increased chance of
Mhm.
having ovarian cancer?
Yes, this is definitely something that's being actively investigated more and more. What you said is correct. High-grade serous ovarian cancer, there is the thought that most of them begin in the fallopian tube and then migrate to the ovary.
Okay.
Um, so removing the fallopian tubes is thought to be a sort of potential interim step to reducing your risk. Um, and of course, leaving the ovaries intact means that you don't enter menopause right away. So it can be a nice option for a woman who's interested in reducing her risk but doesn't want to enter menopause, perhaps because she's too young, and wants to prolong that as long as possible. But yes, uh, this is something that researchers are looking at, and is definitely something to be considered for high risk women. Now, something we've talked about is even for average risk women, which is to say women who are at a relatively low risk of getting ovarian cancer. Um, Removal of the fallopian tubes is something that can be considered if a woman is having a pelvic surgery anyway.
Mhm.
Um, this surgery is called an opportunistic salpingectomy. So in the United States, women have pelvic surgeries all the time, right? Hysterectomies, fibroids removed. Women are having surgeries all the time for other reasons. And there's an increasing desire to consider removing, if a woman is having a surgery anyway and she's done with childbearing, to consider having her fallopian tubes removed at the same time,
Okay.
specifically for cancer prevention. Because if you're going in there anyway, the surgery is relatively quick, safe, um, and not particularly risky. So it's something that even an average risk woman could consider if she's having surgery anyway. Um, it could be a way to potentially reduce her risk of ovarian cancer. And this is something that is, this concept of this type of surgery is not brand new. I mean, it's in the gynecology space. This is something that's been well known and talked about for a while, but I don't think that there is much public awareness of this as an option.
Right.
And so a lot of women don't know to ask about this. Perhaps their doctor might say, hey, we're going in there anyway, to take care of these fibroids, say you've got. Why, would you be interested in having me take out your tubes? But if a doctor isn't suggesting it, a lot of women don't know to ask about it.
Mhm.
So it's something that we as an organization are trying to educate women about, that, hey, in certain circumstances, this is something that might be right for you. To be clear, we're not suggesting that a woman who is at low or average risk of ovarian cancer go in and have her tubes removed only for this reason. That's not what we're suggesting. But if she's having surgery anyway, it could be something to talk to your doctor about, because
Okay.
it will dramatically reduce your risk of ovarian cancer.
Yeah. And I keep going back to the lack of kind of public awareness there is on this
Yeah.
issue. Do you think it's not only is it hard to detect, but do you think the reason why it's because our OBGYN physicians aren't stressing too much about this, or do you think they're doing enough actually when it comes to spreading this awareness?
I mean, I think, doctors are always trying to do their best for their patients. I think ovarian cancer is relatively rare. So I think a lot of general OBGYNs, if they're doing general obstetrics and gynecology, they're probably not seeing a lot of ovarian cancer in their patients, right? So I think it's not necessarily something that is top of mind for a lot of OBGYNs, even though they're aware well of it as a major women's health issue. Um, I think oftentimes ovarian cancer doesn't present in the OBGYN's office. right? It presents to someone, to a, gastrointestinal doctor, because a woman is having the symptoms that you described. And so she goes to a GI doc. She goes to her primary care physician and presents with these weird general symptoms that don't even necessarily, for the doctor, trigger, oh, this could be a gynecologic issue, because it doesn't necessarily sound like it is. Um, so while I think that there is an awareness of it in the medical community, I think because it presents in this way and not necessarily as sort of gynecologic in nature right away, um, women end up, yeah, with the GI docs, they end up with their primary care physicians, they end up with a psychiatrist. I mean, we've heard all kinds of stories about women who know that something's wrong, but they can't figure out what it is, and it takes them a while to land with the right doctor who says, you know what? I wonder if, we should do an ultrasound and a CA 125 here. Um, so this is why we think that awareness among the general public, but also among physicians, of course, is important.
Yeah. It is wild that you mentioned a psychiatrist because you can't, when you have these symptoms, you can't process the food, you're bloated, and it almost ties into anxiety. So
Yes,
people can
right.
relate it to something else. So,
Yes, absolutely.
reading more about what you all are doing, I think OCRA, can you tell us more about what you all are doing to help out families battling ovarian cancer and what resources you all provide for anyone watching that could be seeing this and need some help?
Yeah, absolutely. So we offer a lot. And for families that are going through it, our goal is really to meet every patient and family where they are. So whether they are newly diagnosed and feeling overwhelmed and trying to figure out what to do, or whether they're done with treatment and trying to figure out, okay, what does my life look like now? Now the treatment is done, or whether they've, had finished their treatment 5, 6 years ago and now they're living their life and are looking for a way to give back to the ovarian cancer community. We have resources for them too. So our goal is to really try to be there for patients from the point of diagnosis on. So for folks who are newly diagnosed, we have a lot of resources and information about um, treatment, how to navigate treatment, what is the best standard of care for treatment, how to locate a great doctor. We have a provider finder on our website, and we have a ton of educational resources. One great thing we have is a educational conference that we do virtually every year. We have like 600, 700 people who register every year for this conference, and it's designed specifically for patients and families dealing with ovarian cancer. And we have amazing speakers come in covering topics on treatment, research, survivorship. So it's a great way to not only get information about, way to thrive while living with the disease, but also to connect with members of the community. So that's a tremendous resource. And just so we have video content, online content. We have a ton of groups that meet, educational groups that meet virtually. We have a wonderful team of oncology social workers who developed really robust set of programming for folks who are newly diagnosed, going through recurrence. We have a book club. We have an expressive arts program. We have a group in Spanish. We have, lots of different opportunities for folks to sort of plug in. But for some people, groups are not their thing. I get that. So we also
Yeah.
have a one-on-one mentor program, which we've been running for years, called Woman to Woman, where we will pair a newly diagnosed woman with someone who's been there, and who's a survivor, to offer support and guidance. And that's a wonderful program as well. And of course, all this stuff is, free. So, I mean, we have a nominal charge for our annual conference, but everything else is free that we offer patients. Our goal is to just give people information and also hope, and to know that they're not alone. This is a survivor community that is unfortunately often quite isolated. It's there's not as many ovarian cancer survivors out there as there are for other cancers. And sometimes folks find us and they say, I've never met another woman with ovarian cancer before. And so we really try to help people realize that they are not alone. There are other women who have walked this path, and that when they're ready to connect, we can help them do that in whatever way is most helpful for them, whether that's connecting with a patient or talking one-on-one with one of our social workers. We can help them.
Amazing. Sarah DeFeo, thank you so much for breaking this down and offering those resources to anyone who may need them. And I appreciate your time and information on this topic.
My pleasure. Thank you.